I welcomed a new client to my office the other day, and they were impressed by the amount of equipment I have in this little space. And they said, wow, you must use all this stuff for all of your clients. And I said, kind of. Each piece of equipment has its purpose, right, for evidence-based practice. So there's some modalities back there that we use for some people, and sometimes we don't. But more important than anything in this little office is my anatomy charts. So the first thing that you see when you walk in my office is these charts, right? If you have some kind of spine disorder, say a discogenic injury, we go over the disc anatomy. If you have a muscle tear, we go over the muscular system. A sprain of the ligaments, we go over the ligament chart. Common disorders of the spine, probably my least favorite term is sciatica, because as you can see by this chart, it's caused by a variety of different injuries or issues. Common injuries of the shoulder, from rotator cuff tear to subacromial impingement to AC joint sprains, knee injuries, and probably my most useful chart is the spinal and cranial nerve chart here. It has all the peripheral or cutaneous nerves versus dermatomal injuries, right? So anatomy of the hip. It's a common misconception that PTs only treat orthopedic injuries from TMJ to the toes, but we also treat a lot of neurological pathologies as well. So here's the nervous system, and this isn't even all of them. So if you have a stroke, we go over the anatomy of the brain and how the stroke affects your body. There's also the lymphatic system, circulatory system, endocrine system, respiratory system, digestive system, and anatomy of the heart. Now, I've treated a lot of different people, from physicians and cardiologists to neurosurgeons to everyday people and athletes. And you may say, well, why do you go over this anatomy with these practitioners? Because I treat people the same. And differential diagnosis is very complex. And we use these charts to go over not only what we think's wrong with you, but to make sure it makes sense. It's a teamwork effort. Differential diagnosis and evidence-based practice is a difficult thing. Even after all these years of practicing, it's amazing what we forget. That's why we call it practicing medicine. You may say it's a lot of charts, but that's not even all of them. However, if you do walk into an office and they have this one chart, this subluxation theory chart, I'd like to ask a favor from you and leave, because the human body is a little bit more complex than just one chart to explain it all. So, in summary, movement is medicine, and in order for us to give you the right tools for you to move better, we have to figure out what the pathology and the differential diagnosis is. It's usually never just one thing. I hope this makes sense. Reach out with any questions. Till next time, aloha.